So I'm Sonia, and as Marie mentioned, I work at Vancouver General Hospital at the Lung Center. I've been here for about 2 years, and before that, I was working in the community in Fraser Health. I graduated from the Respiratory Therapy program about 6 years ago. And after I graduated, I worked in the hospital operating ventilators and providing life-saving therapies. But I ended up switching to community care because I was really passionate about chronic disease management, and just preventative measures and providing education. I myself suffer from allergies and a couple of other chronic health conditions, and it took me a few years to identify it and then get them under control. I know I was doing a lot of Googling, and Google can be so overwhelming. I found the best advice that I got was from other healthcare providers. And now I just consider myself really lucky to be in a position where I can give others advice and educate them on respiratory conditions. So now on to my presentation, and my presentation is on surviving allergy season. So I'll start off with, what are seasonal allergies? Seasonal allergies are a group of conditions that cause symptoms like sneezing, stuffy or runny nose, itchy throat, itchy and watery eyes. And seasonal allergies are typically caused by pollens and molds. In the spring, we find that's when tree pollens are the highest. In the summer, grass pollens. In the late summer and early fall is ragweed pollens. And then the winter, and also in the fall, are mold, when it's a little more humid out. So normally people breathe in these substances and they don't have a problem, but when a person has seasonal allergies, their immune system overreacts, and it sees it as a harmful substance in the body. And this is what triggers allergy symptoms during that season. So seasonal related triggers. So these are different from allergens, but these are triggers that might trigger allergy symptoms or asthma. And they are things like smoke, smoke either from campfires in the summer or fireplaces in the winter, insect bites and stings in the spring and summer, chlorine in indoor and outdoor pools, ingredients in candy around the holidays, and then sometimes pine trees and wreaths as well. So testing for seasonal allergies, they can be done in a couple different ways. I myself do skin prick testing here. Other than that, a lot of allergists do, all the allergists do skin prick testing. So skin prick testing involves scratching a little bit of serum on the skin. It's typically done on the forearms for adults and then on the backs for babies and small children. And then what we do for the skin test is we scratch people with histamine and then a bunch of different common allergens. And then we check to see if there's any reactions, like a big red bump. And if they're the same size as the histamine or bigger, then that would be a sign that it's an allergic reaction. I only do environmental allergens, but allergists offer food allergy testing. They changed some of the guidelines for food allergy testing. With food allergy testing now, they only test for food allergies unless you have history of anaphylaxis. Or serious reactions to food, but environmental skin allergy testing is done quite frequently. And when I test for environmental allergens, I usually test for different pollens, cats, dogs, dust mites, feathers, and that sort of thing. I find pollens and dust mites are both really popular allergens that come up in an allergy skin test. And then the other way you can test for allergies is through serum IgE blood test. That just involves your doctor giving you a rec and then going to Life Labs. They draw blood and then they check for allergies in that way. This test, though, is not covered by MSP, so it's not done that often. So asthma and allergies. About 1 in 5 Canadians have respiratory allergies. 75% of people with asthma have seasonal allergies. So most people with asthma have seasonal allergies. Seasonal allergies tend to make asthma worse, and they might be a risk factor for developing asthma in the future. Treating seasonal allergies can reduce asthma symptoms and might even help prevent development of asthma. Individuals who have allergic asthma might need to increase their controller medications, so their inhalers during allergy season. So with asthma, I don't know if you can see this little picture here, there's 2 types. There's allergic asthma and non-allergic asthma. And again, allergic asthma is the very common and popular one that most people with asthma usually have. So what are pollens? Pollens are tiny invisible particles given off by trees, grasses, flowers, and ragweeds. They peak at various times of the year, from early spring until first fall frost. It can be helpful to know which pollens you are allergic to, and then that would be done through an allergy test. Pollen counts are worse on dry and windy days. They blow around with the wind. They're found outdoors, but they're easily wafted or carried indoors on our clothing. Pollens, they stick to our clothes. So some avoidance measures. So how do we avoid pollens? Keeping windows closed overnight to prevent pollens from drifting into the home is very helpful. Also, keeping the windows closed while we're driving. Using air purifiers with a HEPA filter to clean, dry, and cool the air in the home. And I'll talk a little bit about air purifiers on the next slide. Minimizing time outside in the early morning is also really helpful because pollen counts are the highest between 4 to 11 a.m. Pollen counts are the highest on sunny, dry, and windy days. If you can, avoid time outside on these days. But I know that's hard because when the weather's nice, and especially now with the pandemic, we all want to be out and that sort of thing. So when you are outside, once you come home, please change your clothes and put those for wash because again, pollen stick to our clothes. Also try not to hang your clothes outside to dry because pollens will stick to clothes on a clothesline. If you are going to be doing any sort of garden work or outdoor chores, mowing the lawn, and you know you have seasonal allergies, it would be a good idea to wear an N95 mask, although I know those are really hard to come by now. But an N95 mask, not a surgical mask, can help. And then if you can, try to delegate outdoor chores if possible. Another helpful tip is turning on the recirculation setting in your car. That allows the air in your car to recirculate and not pull air from outside. Also, changing the air filters in your car every 12 to 15,000 miles is a good idea as well. So air purifiers. So if you're looking to buy an air purifier, all that I ask is that you get one with a HEPA filter. There's a lot out there on the market. I think there's at least 20 different ones on Amazon. There's so many in the stores and that sort of thing. Just any air purifier with a HEPA filter will work. On the left here, there's the Dyson air purifier. That one is the only asthma and allergy friendly air purifier that's certified by the Asthma and Allergy Friendly Association. But all the other air purifiers do the job as long as they have a HEPA filter to filter out the pollens. I personally have the Dyson one, and I quite like that one. It tells me the pollen count in my bedroom and that sort of thing. So yeah. So how do you check pollen counts? So I have an app on my phone, on my iPhone, and it's called the Weather Network app. You can also just go online to the Weather Network website. You enter in your city, and then it gives you the pollen forecast for that day. So I have a screenshot that I took of from my phone this morning, and today, Monday, April 26th, it shows that there's a moderate amount of birch, cedar, and juniper pollens, and then a low amount of walnut pollens. So right now is when the spring is when tree pollens are the highest. Moving on to mold allergens. So mold spores are airborne and they're found in places where mold grows. Common indoor areas are in showers, bathrooms, bathtubs, windowsills, laundry rooms, kitchen, fridges, garbage containers, carpets, upholstery, attics, and basement. There's no way to completely eliminate mold indoors. The best way to control indoor mold growth is just to control the amount of moisture. There's also outdoor molds that we need to be aware of, and they peak around fall and winter. And common outdoor sources are on decaying leaves, soil, vegetation, rotting wood, and grass on lawns. So some indoor mold avoidance strategies are you can firstly start off by checking the humidity level. So you can get a hygrometer and measure the humidity level. We want that to be less than 50%. You want to have good air circulation indoors by using fans, vents, keeping the windows open, not during pollen season though. Cleaning showers and bathrooms to prevent mildew and mold buildup. Wearing an N95 mask and using gloves to limit exposure if you do have to clean it. If you can, try to delegate and get somebody else to clean mold if you see it. Remove any carpet from any humid areas. Discard any moldy items when possible. Repair any leaks and moisture problems promptly. You can purchase a dehumidifier machine, which gets rid of moisture. So it's the opposite of a humidifier. And you can use this dehumidifier machine in places where there's a lot of mold growth, like basements or crawl spaces. You also want to think about maybe avoiding musty smelling areas like old cottages, basements, garages, attics. And if you do have mold in your home, perhaps think about consulting a professional service for removal. Moving on to outdoor molds. So outdoor mold strategies, if you can, avoid walking, running, or playing on fallen leaves. Avoid raking leaves and cutting grass. Remove piles of rake leaves and grass. And again, try to delegate these outdoor chores if possible. Avoid proximity to hay and straw. Also avoid areas of heavy vegetation where there might not be as good of a air circulation. Also think of stacking firewood in a way that promotes drying and air circulation, because wet firewood will grow mold. And then maybe think about staying indoors after a rainstorm, as molds might be stirred up then. So now moving on to treatments for seasonal allergies. So my favorite, and the one that I recommend for everyone, is saltwater nasal rinsing. So this is flushing out and rinsing the nose with salt water. It cleans the inside of your nasal cavity and it gets rid of all the pollens that you've been inhaling all day. Our nose and our nasal cavity have these hairs that filter out pollens and dust, and pollen and dust just sit there. So if you can rinse daily, it really does help. Personally, it's helped me a lot. During allergy season, pollen season, I find I need to do it regularly every day, and it's great. I love it. There's a few different devices or bottles that you can get. So on the left, we can see a teapot known as like the neti pot. There's a bottle in the middle, and then also on the right. There's also some machines you might have seen ads for on TV that are big and they're electronic. They all kind of do the same idea. It doesn't really matter what device you get, but as long as, yeah, it doesn't really matter which device you pick. I will say though that the bottle on the bottom right tends to be the easiest. I've tried the teapot and I've tried the bottle, and I find the squeeze bottle the easiest to use. And then those big electronic machines, they're a lot of work. You have to clean and sterilize them, and they're quite pricey, and they're really big and they take up a lot of space. So for me, my personal favorite would be the NeilMed nasal rinse bottle in the bottom right. So in the bottle, you want to put in 1 cup of distilled water, or water that's been boiled and cooled down. Distilled water you can buy in a jug from the pharmacy. And then also with these nasal rinse bottles, you can purchase packets, and that contain half a teaspoon of baking soda and half a teaspoon of salt. You can also just make this solution yourself by buying baking soda and salt if you don't want to buy the little packets. And you just put it in one nostril, you get that saline up that nostril, it goes through all your sinuses, and then it goes out the opposite nostril. And then you want to do that whole bottle daily. The next treatment is a corticosteroid nasal spray. So doctors typically recommend these sprays first, just because they're the best treatment for stuffy nose. They're anti-inflammatory, they contain a medication in them. There's about 7 or 8 of them out on the market, but only one of them is available without a prescription. It's called Flonase. The other ones require a prescription. These corticosteroid nasal sprays work best if you use them every day. And it takes a few days for them to work, but once you start taking them daily, the inflammation that we get in our nose and in our nasal cavity from pollens or allergens should come down. These sprays are a lot more effective than other allergy medications for stuffy nose and postnasal drip. There's also decongestant nasal sprays. I don't really recommend these. They do help reduce stuffy nose, but people with health problems like high blood pressure shouldn't be taking them. Also with nasal decongestants, you're not supposed to use them for more than 3 days in a row. You can actually become dependent on them. Funny enough, I actually had a roommate in university, and she was, I would say, addicted to nasal decongestants. She started using them after a cold, and she found herself at this point where she had to take it every day, every few hours. And she was like this for almost a year until she was able to wean off and come off of them. So these are a bunch of different nasal decongestants that are available. And again, I wouldn't recommend taking them more than 3 days in a row. So how to use a nasal spray. So part of my job is checking inhaler and nasal spray technique. And I will say, a lot of people use it incorrectly, myself included. I was taking a nasal spray incorrectly for months because, and I always found that it was like in my throat and I was tasting it. And it was just because I wasn't taking it correctly. So it's very important that you take these sprays correctly, follow your pharmacist's instructions, or you can look up instructions online. I have some here. So when you get a nasal spray, you want to shake and prime the nasal spray into a tissue, empty out your nose, just blow it out, and then point the nozzle of the spray to the outer corner of your eye or towards your eyebrow. So we can kind of see it in that picture there. So we're pointing it away from the middle. And that's because if we point it towards the middle, it can really irritate our septum or the inner walls of our nose. So we want to point it away. And then we want to gently, very gently inhale or sniff the medication. If you snort it or suck it really hard, all that medication will go into your back of your throat where it won't do much good. And then after you've used a nasal spray, you don't want to blow your nose for about 10 minutes or so after you use the spray. Also try not to sneeze because all that medication will come out. So moving on to antihistamine or allergy pills. So these medications can stop itching, sneezing, runny nose, help with itchy eyes. They block allergic reactions throughout the whole body, not just the nasal cavity. They don't treat stuffy nose as well as the corticosteroid nasal sprays. And some antihistamines can make people feel tired as well. They're available without prescription from the pharmacies. There are also stronger ones available that you can get with a prescription from your doctor. And then because those are prescriptions, sometimes you can get those covered as well. Then there's also antihistamine eye drops. So these are also available without prescription. They help with itchy or gritty eyes. And then moving on to immunotherapy allergy shots. So some people with seasonal allergies choose to get allergy shots after a discussion with their doctor. It has to be prescribed by an allergist, not a family doctor. So allergy shots are usually given every week or month by an allergist or an allergy specialist. It contains a small amount of allergen. So they're injecting you with something that you're allergic to in very tiny amounts, and then they go up in dose, and so that your body can tolerate these shots. These shots take a few months to work, and right after, when you first start them, you might find that your allergy symptoms are actually worse because they're exposing you to an allergen. So it's a long process with these shots. It's a lot of commitment, but it can help you so that you can tolerate allergens a little bit better. And then just to know, if you have asthma, your asthma must be well controlled for at least 6 months before starting these shots. If your asthma is not well controlled, as in you have asthma symptoms more than 3 times a week, or if you've had any flare-ups in the last 6 months, then you cannot start allergy shots because it can make your asthma worse. Then there's immunotherapy or allergy pills. So for some types of pollen allergies, there are pills that work as well, just like allergy shots. You start off at a low dose and you work your way up. They also have to be prescribed by an allergist, and they're dissolved underneath the tongue. They're taken every day for many months, and again, it takes many months to show an effect. And again, your asthma must be well controlled for at least 6 months before you start these allergy pills. So now moving on to COVID versus asthma versus allergies. So I know now this time of year, allergies are a little bit worse, but it can be hard to differentiate what might be causing or triggering these symptoms. So if you're having a dry cough, that might be COVID or asthma. If you're having a phlegmy cough, that might be allergies or postnasal drip. It could also actually be asthma. If you're having chest pain, that might be COVID. If you're having chest tightness, that might be asthma. If you're having shortness of breath, COVID or asthma. Wheezing would be asthma. Fever would be an infection, so COVID. Sneezing would be allergies, and itchy, watery eyes, nose, itchiness is allergies. So there's that. Okay, so that's the end of my talk. Do you have any questions?